Greetings to all, and welcome to this very short recorded presentation on the Zika virus. My name is Dr. Alvin Chitterman, and I made this presentation on the Zika virus because so many persons in Grenada is infected with the Zika virus. So today you'll have a better understanding of the transmission of the Zika virus. What are some of the symptoms that you can display if you are infected with the virus? And what are some of the techniques that you can employ to prevent the transmission of the Zika virus? So we'll start off with the introduction. So the Zika virus is transmitted from persons to persons by mosquitoes. And this special type of mosquito is the Aedes mosquito. Now, if we know how the Zika virus is transmitted, we can control the population of the Zika virus, right? So we can control the mosquitoes and decrease the transmission of the Zika virus. Now, if you become infected with the Zika virus, it leads to a mild fever. And in addition, you could develop some other symptoms like headaches and red eyes, etc. I have a slide later on to explain that. Now, the Zika virus and other viruses like the dengue virus and the West Nile virus, they are all family. Now, the Zika virus was first discovered in 1947 in Uganda, Zika forest. If someone becomes infected with the Zika virus, they can start experiencing symptoms as early as 3 days or as late as 12 days post-infection. Now, keep in mind that most cases of Zika virus infections, persons are not contagious, meaning that they cannot transmit the virus from persons to persons. However, there are some exceptions. So the virus was first detected in the rhesus monkey in 1947. Then 7 years later, we had the first recorded human infected, and that was in Nigeria. The first major outbreak where many other persons become infected was in 2007, and that happened in a small group of islands in the Western Pacific Ocean. Then we had another large outbreak in 2013, and this one happened at a different location in the Southern Pacific Islands. Now in 2015, the Zika virus entered into Brazil, and there are a number of infant deaths, and children were born with very small heads and small brains in Brazil. So that was in 2015. So there is strong evidence to suggest that there is a correlation or there is a link between the Zika virus and microencephaly. So microencephaly is that term we give for persons that are born with very small head circumference or very small brains. And if someone is born with a small brain, it would affect the way they develop, the way they think, and the overall functioning. So that's how important Zika virus infections can be. As a result of Zika virus link to microencephaly, the Center of Disease Control issued travel warnings to countries where Zika was predominant, right? So they advised pregnant women or women who was thinking of becoming pregnant to prevent traveling to these countries. And here I've listed a number of these countries. Some of these countries are within South America, some of them is within Central America, and the others in the Caribbean. And these countries are in the tropics, and this is where the mosquitoes can breed and multiply in large numbers, right? So that's where we had such large amount of cases in the Zika virus. So how is the Zika virus transmitted from persons to persons? So the infected Aedes mosquitoes can bite humans and transmit the Zika virus from persons to persons, right? So these mosquitoes that thrive well as any other mosquitoes in stagnant water. That's where they're going to lay their eggs. Here in Grenada, we do have a lot of barrels on the outside where people collect rainwater, and these barrels are not covered. And this is perfect breeding site for mosquitoes. So the mosquitoes that spread the Zika virus, the chikungunya, and the dengue fever, these mosquitoes are more active during the day. In the night, they are active also, but they are more active during the day. So again, when these mosquitoes feeds on someone that is infected with Zika virus, the mosquitoes themselves become infected. And so when they feed on another human, they can transmit that infection to that human. And so that's how you could spread the disease from one person to the next. So studies have shown that the Zika virus can be transmitted from the mother to the baby. And during the birthing process, when the mom is giving birth, the virus can infect the newborn during the birthing process. Currently, there is no reports to suggest that infants can get infected with the Zika virus by breastfeeding. And so we encourage mothers that has the Zika virus to continue to breastfeed, right? Because the advantages of breastfeeding outweighs the risk. So what are the symptoms of someone who develops the Zika virus? What are some of the things we can expect to see? So here I have a diagram on the far upper right of many symptoms you can see in a patients who develop the Zika infection. But keep in mind that most patients are asymptomatic. 1 in 4 people show any symptoms at all. Right, so the patients tends to be asymptomatic, showing no symptoms. However, if these patients show symptoms, right, they could develop, headache, fever, red eyes, joint pain. Here we have a type of rash called maculopapular rash. Here we could see the same type of rash. Here we could see a patient with conjunctivitis or red eyes. Patients could also develop rest symptoms like digestive problems like diarrhea and constipation and abdominal pain. So this is what microencephaly looks like. So here we have a child with a normal size head. Here you see we can measure the circumference or the length around the head. But infants that are born with microencephaly, here we can see this should be the normal size of the head. Right? But the circumference in these infants are much smaller. And here we have a patient with severe microencephaly, right? So imagine if this head is not large enough, most likely the brain is also small, and this is going to affect the overall functioning of the child, right? So there are many causes of microencephaly, but what we notice from several studies is that many Zika infected moms gave birth to infants that had microencephaly. And that was the reason why the Center of Disease Control alerted women or potential mothers to restrict travel to Zika infected areas. So if someone is infected with the Zika virus, how would they know? So you could go to your primary care physician. He would take some information from you. So he would ask you questions about your travel history. The whole idea is to know which country you recently traveled from, if you did, and be able to correlate whether it's a Zika infected country. And then the way you present with your symptoms would be very important. Again, if you want to confirm your diagnosis, you would want to do a blood test where we look for antibodies against the Zika virus, and we could do a PCR for the Zika virus, right? This is very accurate. If this is positive, most likely the DNA of the virus is within your system. So what are some of the things we can do to prevent the virus transmission? So we know how it is transmitted. So if we control the population of mosquitoes or we eliminate the breeding sites, we'll be able to decrease the mosquito population. And so we can empty stagnant water in and around the home, like in barrels, we could empty that water. We could, if you have water that you intend to use, make sure that it is covered so that mosquitoes cannot enter into the water and makes it a breeding site for the mosquitoes. If your drains are clogged up, you would want to clean your drain. to allow water to flow freely. Again, that would decrease the breeding site for the mosquitoes. If you live in an area where there is a lot of mosquitoes, you could also use screens on your windows and in your doors to prevent mosquitoes from coming inside. Or you could wear long clothes like long sleeve shirts and long pants to prevent these mosquitoes from feeding on you. And you could use repellents, again, preventing the mosquitoes from feeding or biting you. And you could sleep under mosquito nets. So what is the treatment for someone who is infected with the Zika virus? So currently there is no vaccine. There is no antiviral drug, right? Treatment is basically to treat the symptoms in patients that are infected with the Zika virus. So for example, if a patient develops headaches, pain, and fever because they are infected with the Zika virus, we give them symptomatic treatment. So we could give them ibuprofen to help them with the symptoms, but there is no drug that you can take to eliminate the virus from your body. So the best way to deal with Zika virus is to prevent the virus infection, right, by taking the numerous precaution measures that we spoke about. So I hope that you enjoyed this session. This was a very short session. I hope you enjoyed. I hope you learned something. See you next time. Bye.